Hi, my name is Jeremy Liew, and I'm a Time for Kids kid reporter. I'm 13 and I live in Connecticut. Today, I'm talking with Dr. Walensky, the director of the CDC, about vaccines and mask guidelines. The CDC just surprised us by announcing that people who are fully vaccinated don't have to wear masks most of the time. Does that mean that if you're fully vaccinated, life can go back to normal?
I think we should first define what fully vaccinated is so everybody understands. So, for kids 12 to 18, fully vaccinated means that you got 2 doses of the Pfizer vaccine and then you waited 2 weeks to make sure you were completely through getting your whole immune response. And so that's what we're defining as fully vaccinated. So if you're fully vaccinated, we have now said that individuals are safe and that they can take their mask off. I think it's going to take some time for us to get back to what we call normal. And I think we're probably going to get back to perhaps even a new, better, safer normal. But I do think that this means that we're taking another giant step to getting back to the lives as we once knew them.
So, what happens if someone who isn't vaccinated doesn't wear a mask?
And what we would say is for people who are not fully vaccinated, that they continue to not be protected. So that guidance for them would be 1, go get vaccinated. 2, wear your mask until you're fully vaccinated. And then if you decide not to get fully vaccinated, then continue to wear your mask and practice all of the mitigation strategies, distancing, masking, hand washing, and all of those things that we have been recommending for months now.
You also recently announced that kids aged 12 to 15 are now able to get the COVID vaccine. Can you tell us more about that decision?
We have known that the Pfizer vaccine, when it was first authorized, went down to kids the ages of 16 and up. What they generally do in those studies is first they test them in the adult ages, and then they do different kinds of studies to make sure that they are also safe in kids and that they are getting the same immune response. So they just did a study that we looked at the data with the Food and Drug Administration in over 2,200 kids, and they showed that the vaccine was both safe and it was 100% protected. So there were 16 cases of COVID in the kids who didn't get the vaccine, and none in the cases who did, in the kids who did get the vaccine.
What if your parents don't really want you to get vaccinated, though?
So that's certainly going to be a family discussion. And what I would really encourage both teens and parents to do is get more information and to talk to trusted advisors in your community, your pharmacist, your pediatrician, local health departments, your clergy sometimes, and really go and talk to them about the benefits and risks of potential vaccination to understand your concerns.
Sophia from New Jersey asks, how will schools handle some students being vaccinated and some not? And Victoria from Pennsylvania asks, do you think that eventually students will be required to get the COVID-19 vaccine?
We now have to revise our guidance for how schools are going to handle kids who are vaccinated and some who are not. There are going to be some kids who are not eligible simply because your school has kids ranging both before the age of 12 and above the age of 12, right? And then there are going to be some kids that have, some schools that have kids that are entirely eligible. Right now, the vaccines are not approved, they're authorized for use. And so that's sort of another step in the process. We don't have any vision right now that we as a part of the federal government will require vaccination, but that's going to be at the jurisdictional level. Each city, county will make those decisions.
So Abby from Hawaii and Miguel from Texas are both 11 years old. They want to know when they'll be able to get the vaccine.
We are waiting for data from the FDA. First the 16-year-olds, then we went down to 12. I think the next bracket's going to be down to 9 and then down to 6. We're really hoping that we'll see some of those data in the fall and that soon thereafter we'll be able to get that age range vaccinated soon.
Ellen in Virginia has another question for you. She asks, COVID-19 has been a disproportionate burden on some groups. Can you talk about how you are connecting with and serving people from these diverse communities?
We are doing an extraordinary amount of outreach in terms of mobile vans, in terms of trusted messengers, faith-based organizations, community-based organizations. I'm really, really pleased to say that just this past week, we've put some more data on the CDC website that demonstrates that we're making enormous strides in getting vaccination to the most vulnerable communities.
Well, thank you, Dr. Walensky, for speaking with me. We learned a lot about how COVID vaccine will affect kids' lives.
Go get vaccinated.
It's one shot I'm looking forward to get.
Yay.